It means a lot to be Whittier in 2023. It means imagining the possible, imagining justice, imagining what is right here in our own great city. We see and hear about injustice all over the world, from Memphis to Minneapolis to Haiti to many parts of Africa. But all that we see and hear around the world is also happening here in Boston. Given our wealth and resources, there's no excuse. It's unconscionable that there is a 20-year life expectancy difference between Boston's poorer neighborhoods and our wealthier neighborhoods. We should all be outraged at this difference. And at the same time, we should also be hopeful that it can be fixed. Whittier serves as a beacon of hope, creating opportunities for our patients to live healthier lives and reaching their full potential. It also means making sure patients in the community regard Whittier as a trusted partner.
The mission of the Whittier Street Health Center is to address health equity, social justice, and the economic well-being of its diverse patients. 27% of Whittier patients are uninsured, but no patient is denied care regardless of their ability to pay. 100% of social service programs that address the barriers to wellness are free.
This is a community that has a lot of needs. So to be able to be in this community and to have an opportunity to make a difference is huge.
My focus here started as HIV, and that's still what I mostly do. Our team, which consists of myself as the physician, a full-time nurse, and several case managers, and then community outreach people, work hard at trying to identify people with HIV and get them into care, and then once they're into care, keep them in care. And it's my goal to provide all of the patients here that need infectious disease care with state-of-the-art infectious disease care that's equal in quality to what they would receive anyplace else. And in order to do that, we have to go and meet people where they are in many cases and make the extra effort to see to it that they receive that care. By means such as, going to their houses to give them their medicines, picking them up to bring them to their appointments, going out to Mass and Cass and bringing them here.
The Day Engagement Center opened its doors as a safe place for the homeless. Whittier vans provide transport from Mass and Cass and Nubian Square. Here, they can receive supports or just be in a safe and respectful place.
It's a place for you to come that we just opened up. You need to come
What I
there.
say? I'll be here.
And she said, I'll be there, I promise you. I said, now don't promise me, promise yourself.
Nobody's born saying they want to become an addict. We got to think about that. Everybody has a story. They're human beings. And I think that's why they like coming here. It's like I treat them like individuals.
Cereal.
You want cereal too, Brad? Yeah. Daily, we give them breakfast. We have some type of computer, like I'll teach them how to use a computer, how to use their emails, and that way they have, an access to see where their housing status is. We have an ESR group, Early Support Recovery group, and like at least 5 of my clients have been going to the Early Support group, and it's been growing really good. I love helping people. It just gives me such a great feeling. When I accomplish something, when I help somebody accomplish a goal or something, it just gives me a great feeling. I can't explain it.
The teamwork at Whittier is extraordinary. This is Angel. She came to Whittier after experiencing panic attacks. Dr. Wright and Brenda were her support team.
It was during a class session that you just hear, wow, school closed, students need to get home in the middle of a class. And that really had an impact on me then, but I just helped my children to exit easily. And then over the months, we spent time at home doing learning from home with the students. And so then the call came back to go back to school. And being very energized, I went back to school, but it was not the same.
And she was having difficulty integrating back into the classroom. likely due to that traumatic event, she may have felt that it was going to happen again. She may have felt stress or anxiety. She may not have felt safe.
When I first met Angel, it was very clear that she was experiencing acute trauma symptoms, very classic, lots of anxiety.
She was able to provide an environment that was safe for Miss Simpson. She rendered treatment through various therapies.
In addition to traditional therapy, Brenda encouraged Angel to join the 1290 Club, Whittier's social support for seniors, and work in their public garden. This garden also provides homegrown food for the food pantry.
So I would come there every Wednesday. I would meet with the people and do the planting of everything. And that begins to release a lot of stress. It's just like, it helps soothe your body.
A lot of the individuals we see here at Whittier have gone through a lot of trauma, chronic trauma, years of trauma. And to be able to come to a place where they can feel safe and get the support that they need to help them and guide them so that they can live better lives gives me great satisfaction.
Meet Ja. They receive counseling from Brenda.
I want people to know that I'm non-binary, that my pronouns are they, them, and my name is Ja.
A 2020 survey conducted by the Center for American Progress states that experiences in healthcare, housing, and education show that LGBTQ people of color encounter heightened discrimination.
It's somewhat difficult for them in terms of coming out and admitting or, feeling like they're safe to say, this is how I identify or this is how I do not identify.
I feel like Brenda understands me, and Brenda kind of just eases. She lets me tell her what I want to tell her, and then we'll ease later into the rest of the stuff, and I appreciate that.
I have seen the potential to go on and to be an amazing person, to be an amazing educator, as well as a strong advocate for the LGBTQ community.
I want to be a teacher. I want to be a teacher so bad, like so bad. And I don't want to be a teacher to teach kids. I want to be a teacher to make kids confident, to make them love themselves. That's what teaching is about.
So this is pretty much how your schedule is looking like for the rest of the day.
Dr. Robin Mayfield's dedication sets up her patients for success through telehealth and culturally competent care.
Culturally competent care is incredibly important because it is what is necessary in order for patients to understand what's going on, in order for them to develop a sense of trust.
Dr. Mayfield is an excellent doctor, very thorough, calm, takes her time.
When I first met him, he didn't recognize that a lot of the symptoms he had were secondary to diabetes, and so he would want to treat the symptom.
Through the new telehealth remote monitoring at Whittier, Everest can have his glucose levels monitored, making his diabetes manageable.
I have a monitor right here, right on my arm, and I've had it for almost 6 or 7 months. Thanks to my doctor, Dr. Robin Mayfield.
Success with my patients, to me, means that we're able to connect as people. It's incredibly rewarding when I see changes in behavior, lifestyle changes which aren't easy to make, and also changes in numbers that prove that we're making a difference in their lives.
The experts at Whittier are ever evolving to find ways to create better avenues of success for the community that they serve. School-based clinics, mobile programs, satellite clinics, and home visits, just to name a few. The workforce training program works to increase the earning potential of the community. Meet John. He started at the Whittier Street Health Center as an intern in human resources. He was a student at the Cristo Rey High School and a graduate of Lincoln Tech. He is now a full-time medical assistant in Whittier's pediatrics department.
Whittier is a good place to come. We care about every person who walks through this door.
Presented with the opportunity, John reaches out to peers to help them find a path to success, just like he did at Whittier.
I have a couple of patients who are close to my age and don't know what to do with their lives, and they want to become a medical assistant or become in a medical field. And I tell them, hey, you're almost your age. I did this, I did that. So they're like, oh, so it's good to motivate them and give them ideas of what to do and how to, start their journey to become in the medical field.
Say hi to the camera.
I realized that I was the only person in my family to be in the medical field, so I wanted to, make sure I did everything I can, do my best to make my family, happy and proud, and here I am now.
The return on investment at Whittier is so high. They do so much with so little. But given the mission at hand, if we really want to solve health inequity, if we really want to improve life expectancy, we need to give of our resources. Intent and good words are not enough. If you believe in Whittier's mission, my wife Annetta and I believe we have a moral obligation to do something, to give of ourselves and resources. Hopefully you might feel the same, and we really believe that one person at a time can really make a difference.
Mobilizing for healthcare equity and social justice, one person, one family at a time. We are the Whittier Street Health Center.